The biggest problem with Alzheimer's disease is like the biggest problem with cancer. We need effective drugs, effective treatments that work. We don't have effective treatments that work right now. Basically, I do MRI imaging of Alzheimer's disease, and the overall goal of my work is to find better methods to diagnose Alzheimer's disease, to monitor its progression, and especially to find treatments which slow the progression of Alzheimer's disease and prevent dementia. The ability to light up the brain, to see the brain with imaging, both MRI imaging and PET scanning, has totally transformed all studies of the brain, especially studies of Alzheimer's disease. It's just unbelievable now what science can do and what we can see and the advances we can make, because the brain is the last frontier in medical science. And there's years of work to be done to understand just how the normal brain functions, what happens to people as they get older, and then there's Alzheimer's disease and all kinds of mental disorders. So what we call neuroscience is the most rapidly growing area of scientific work today. The Alzheimer's Disease Neuroimaging Initiative is the largest single project ever funded in the world for Alzheimer's disease. The National Institutes of Health, NIH, and the pharmaceutical industry have teamed up together in an unprecedented way to provide $140 million for the study of Alzheimer's disease. We study normal people, people with mild impairments, and people with dementia from Alzheimer's disease, with all kinds of scanning and blood tests and clinical tests. And basically what we've found is ways to detect the disease at an early stage reliably and predict who's going to develop Alzheimer's disease in the future. And we found better ways to map progression. So the big impact of our study is that when clinical trials now are done to test out treatments for Alzheimer's disease, they're using the methods that were developed by our ADNI project. The good news is that there are hundreds of treatments now being tested on humans. So never before have we had, just 10 years ago, there was nothing being tested on humans to prevent the progression of Alzheimer's disease. Now there are hundreds of different kinds of treatments. Some of them still in the animal stage, but many are now being in human testing. And some of them have not worked, but there's many more in the pipeline, and it's going to take time, but there's going to be something that works.